Well, hello and welcome to Rajya Sabha TV. You're watching India Fights Back with me, Rajat K. In this episode of the show, we'll take up the subject of advisory on vaccines. Now, as India began its mass vaccination program, billed as one of the largest mass immunization program ever, there have been some advisories on do's and don'ts, especially in the wake of contraindication for use of vaccine. Well, in medicine, a contraindication is a condition or a factor that serves a reason to withhold a certain medical treatment, in this case, any drug, due to harm it may perhaps cause to the recipient. Now, as per the ICMR, both COVID-19 vaccines, Covishield and Covaxin, approved for emergency use in India, are safe for patients on blood thinners. There have been other advisories as well in the past, and gradually we are seeing that these vaccines are being cleared for use of the patient. Now, initially there was some fact sheet put out by both COVID-19 vaccine manufacturers, and they had listed use of blood thinners as one of the contraindications for the use of this vaccine. Experts believe that could have led to a huge chunk of Indians choosing to avoid getting a shot of a vaccine. But now, both the companies have written to the Drugs Controller General of India, or the DCGI, regarding change in the position or the fact sheet. To discuss further on this important issue, we're joined with Dr. Rakesh Agrawal. He is Director, JIPMER from Puducherry. Many thanks, Doctor, for joining us. Dr. Rana A.K. Singh, he is Medical Superintendent, Director, ABVIMS and RML Hospital, and Dr. Neeraj Nischal. Well, many thanks for joining us, Dr. Neeraj Nischal. He is Associate Professor, Department of Medicine from AIIMS. Many thanks, sir. Let me start with you, Dr. Agrawal. For the benefit of our viewers, could you explain how important are the advisories in terms of contraindications? Earlier, a couple of weeks ago, we saw there was an advisory by Covaxin that there are patients or other people who are on immunosuppressants should not, as of now, take their vaccines. And now we are seeing this advisory or later clarification that both the vaccines are now safe for people on blood thinners. How important contraindications are to understand for any vaccine?
It's not specific to COVID vaccine. Contraindications are not absolute contraindications. These can be absolute, these can be relative.
Okay.
An absolute contraindication would be something that should just not be done.
Okay.
For instance, some vaccines which contain a live virus, we would not give to a pregnant woman or somebody who's immunosuppressed. That's an absolute contraindication.
Right.
But most of the contraindications that we talk about are relative. You see, this could be because, and these could be because it could be risky to give the vaccine, maybe slightly risky, or the vaccine is less likely to be effective, and those contraindications are relative. A doctor or somebody knowledgeable has to weigh the benefits versus risks and then decide. There are many situations where even the manufacturers say that a vaccine should not be used, but for public health purposes, the public health authorities or regulators have allowed that to be used. For instance, the influenza vaccine that we have, which is used much less in our countries. In many countries, even though manufacturers say that it cannot be used in pregnancy, for public health purposes, it's even being given to pregnant women, because if their risk of getting the disease during pregnancy is high, it can be used. So that's where we are. And some of the contraindications that you talked about, giving it to COVID vaccines that we have available in India to immunosuppressed people, or giving them to people on blood thinners, those are very relative contraindications. Those were never absolute contraindications to begin with.
Right. That's very important, sir. So clearly, these are advisories that definitely keep coming for any vaccine. Dr. Rana A.K. Singh, let me understand the concept of blood thinning. Now, for any vaccine, as Dr. Agrawal also explained, there are contraindications that are listed, and of course, there are advisories. Now, as far blood thinning goes, initially, when the advisory came from Covaxin, experts have said many Indians would definitely have been hesitant in terms of taking a shot. So, is blood thinning a relatively common usage drug or a procedure in India?
No, the use of blood thinner, I mean, is not very common. It has got very specific indications because of which the people are put on blood thinners. Like somebody had, like a cardiac element, especially
Right,
say
right,
heart attack or so, and if they have undergone angioplasty. So in that case, they have to be on blood thinner. There are many more indications. Somebody had the history of DVT, then the deep vein thrombosis, then they are on blood thinners. But
right.
as such, India is a very vast country. So no matter what, even if the percentage is less, the absolute numbers could still be large. But in whole scenario, if you look at it, there are not, I mean, it's not a very large population who is on blood thinners.
Okay.
Now, let us look at the use, I mean, the vaccine vis-a-vis blood thinner. One thing is very clear that this vaccine has no interaction with the blood thinners. I mean, it does not interact, neither it increases or decreases the efficiency of the blood thinner, nor it increases or decreases the efficiency of the vaccine if the patient is on blood thinner.
Right.
One thing was of concern to begin with, because these injections are given in muscle. I mean, intramuscular injections. Muscles are highly vascular organs. I mean, they have got a lot of blood vessels. There's a huge blood supply in the muscles. So it was possibly perceived that if somebody is on blood thinner, if we give intramuscular injection, the patient can have bleeding at the site of injection, can develop blood collection there, and it can get infected. So that was initial apprehension, but it is clearly believed that we inject this vaccine with very thin needle. So
Okay.
if somebody gets this injection in the muscle, keep that area pressed for a while. I mean, the pressure is the simplest and the easiest way of controlling the bleeding. So that will keep, like that will reduce the possibility of blood collecting there or getting infected there. So that is one way. We give it with very thin needle, keep that area pressed for a while. Like somebody wants to be extra cautious, like if you are on blood thinner, you can avoid, I mean, like previous dose, I mean, previous day dose, you can take in the morning, and the today's dose, you can take, I mean, you can space it so that, I mean, these are smaller precautions one can take. So blood thinner, I don't think it should be absolute contraindication, little bit of precautions. Again, I'll tell you, if there is a clear-cut, unambiguous advisory from the manufacturer of the vaccine,
Okay.
written advisory, then it won't be a very prudent idea to transgress or to disregard that advisory, because there are a lot of things. I mean, if we go into the detail of that, that will consume the whole of the time. So as such, blood thinners are not contraindicated. If you are on blood thinners, I mean, you can space the blood thinner vis-a-vis the injection, keep the injection site pressed for a while. So that's my take on this.
Right, right. Dr. Rana Ek Singh, many thanks for your explanation. We'll definitely come back to you and explore a dimension of the subject of advisories on the vaccines. Dr. Nishchal, now, as both our panelists, Dr. Agrawal and Dr. AK Singh, explained about a specific aspect of blood thinning and, of course, like the contraindications. Now, by and large, given the advisories, or can it be deduced that so far these vaccines are safe and there should be no hesitation? We initially saw in the first week there was a hesitation, and there have been some centers who reported the recipients' percentage was far less than expected. So clearly, to stave off any apprehension or doubt, can we say these vaccines are absolutely safe?
Yes, definitely. See, it was very clear that this vaccine will be taken by almost whole of the population. So if there was any chance of any safety concern or anything, any of the serious side effect concerns, then definitely this would not have been lost. So once it has been launched, every precautions have been taken regarding all the safety parameters, and efficacy may be again a question, a debatable question. But as far as I'm concerned, I feel safety is the most important aspect.
Yes.
And people should not be concerned about the safety of this vaccine because it's almost more than 2 weeks in the program, and most of things, whatever side effects have been reported, usually have been minor side effect, which is expected from any vaccine per se. And regarding this blood thinner aspect, again, if we see the vulnerable population, which we expect to benefit from this vaccination, many of them will be on some sort of anticoagulant or say antiplatelet drug. So we will be excluding most of them, which are the most vulnerable population. So that's why I think I feel it was playing too safe about the vaccination program, because if something went wrong in the start of the program, then the hesitancy would have increased much more.
Okay.
I think that's the reason why this was included as a relative contraindication, but that was taken too seriously that even patients on EcoSprint were hesitant on taking this vaccine. But I think intramuscular injection, this particular vaccine will outweigh whatever benefit, will outweigh whatever little risk it has because of the blood thinner or the anticoagulant the patient is with. But of course, if somebody has uncontrolled bleeding manifestation or something which is not controlled, INR is very raised, then of course these patients should be cautious. And it's important that whenever you go for vaccination, inform your doctor on which medication you are on, and let him take a call on that thing.
Exactly. So, as we keep on saying in our program, please listen to experts. So here we have Dr. Neeraj Nishkal just telling us, whenever one goes to vaccination, tell your doctor what is your medical history, or are you having any pre-existing disease, disorder, or you taking any medication. Dr. Agrawal, in theory, when we conduct a trial on any drug, so its merit vis-a-vis contraindications or any side effects, does it come out during the trial? Or I know it's usually the initial phase of vaccination or the usage of drugs we get to know about it.
So when we study a drug or a vaccine in a trial, it is generally given in the initial phases to very limited group of people. For instance, initial trials with these vaccines were done in young people.
Okay.
Thereafter, in the phase 3, they also included elderly people where side effects could be more common. And we had safety data for at least 2 months for a large number of elderly people also. So that we were sure before we started vaccination that there were no adverse events associated with this vaccine, even among the elderly. But very specific groups, such as those on blood thinners, etc., that would be very difficult to know from the trial. And that we know what the risk of a person on blood thinners are. The only risk is that of a small hematoma forming, a small blood clot forming within the muscle. And that can be extrapolated based on our prior knowledge. We don't need to have trial for each such small subgroup.
Right. So it's clearly right.
So that is where we are. Efficacy is studied in a large group. And again, that has been studied in very large group with the vaccine, say with the vaccine that we have. And we look at those data and we extrapolate from there. Again, every small group, we may not have data. We have data generally on people with comorbidities. But for each comorbidity, whether it is thyroid hypothyroidism, whether it is hypertension, those may not be there. We look at groups as a whole.
That's what we have to look at these tests as a whole. Dr. A.K. Singh, as we were discussing about blood thinning and contraindications vis-a-vis these two vaccines, now if we look at the subsets of the recipients, would there be any category of people in terms of the age groups that one would define, that you as an expert would advise to be mindful of their own medical history?
I think just now during the course of discussion, which has happened over last, like 20 minutes, it has come out that this vaccine is intended to give immunity against coronavirus to the recipients. Uh, uh, I must confess at this stage that I got my vaccine on day one, that is 16th of this month. I
Yes,
got
yes.
it because I believed that this is probably the only weapon which is in our hand which can protect me against this deadly virus infection. Because when the corona infects somebody, majority of the people they become okay, but when it takes bad turn, then it can easily become rapidly fatal. So I thought this is a definite weapon I should use, and I took on day one. Now let us look at the elderly people. There is a subset of patients who are more vulnerable to develop infection. One of that subset is an elderly people.
Okay.
Then to add to insult to injury, if somebody who is aged has got certain comorbidities, like you've got cardiac illness, pulmonary illness, your kidney is not functioning well, your liver is not functioning well. So any serious disease which affects somebody does many things in the body. Of all the things, the diseases they are known to reduce the immunity of the person. Like like if we talk about the immunosuppressed patients who are post transplant patients, their immunity is reduced. So what happens if your immunity is reduced because whatever reason, age, multiple comorbidities, you are on immunosuppressant drugs, uh, so that means you are more vulnerable not only to contract this disease, not only to infect, not only to get infected with this deadly virus. Suppose this group of people, when they get infected, the adverse outcome is very high in this subset of population. So I mean, what I am saying, I can wind up by saying that because the group which I just discussed, they are more vulnerable for contracting the disease because of the multiple factors affecting their immunity in a negative manner. So they are the people who must be proactive in taking vaccine, because this is so important. So I will say that of course there are certain contraindications as we were talking about. One of the contraindication is that if you are suffering from any active disease, like if you have got fever, you have got acute attack of bronchial asthma or any active disease, this is not the best time to take the vaccine. Wait
Okay.
for this active disease to go away and then you should take vaccine. But certainly the people whose immunity is low, because they are more vulnerable for contracting this infection, so they must be proactive in taking the
Okay.
vaccine rather than not taking.
Dr. A.K. Singh, as you mentioned that you were amongst the first the groups who have taken the vaccine, and we have interviewed you, and very candidly you had shared your experiences. Just to recall that, did you I mean, in terms of the adverse reactions, since in this show we also create awareness about the vaccine and stave off any apprehension. So, is there any adverse reaction that you faced after having a vaccine, or you can advise something about it?
Uh, on the personal front, absolute no. But I want to elaborate on that. We have vaccinated close to 1 million people in our country. I do not know the absolute numbers, but I'm sure it's going to be close to 1 million people. And if
More
you
than 2
look at
million, yeah.
that adverse reaction, serious adverse reaction is practically negligible. Now, if you talk about the adverse reaction, there is hardly any drug which has been manufactured so far, hardly any vaccine which has been manufactured so far, which does not cause adverse reaction. I mean, you take over the counter paracetamol tablet. If you are prone, you can develop reaction even after consumption of the paracetamol tablet.
Okay.
So, if we look at the adverse reaction after vaccinating close to 1 million people, serious adverse reactions so far has been practically
Right.
negligible, I must say.
Right, Dr. A.K.
Little
Singh.
bit
Yeah,
of
yeah.
fever, like little bit of tiredness. They are
Right, sir.
indirect evidence of surrogate markers that this vaccine is doing its job in your body. You are probably generating antibody. So these smaller reactions which we talk about is probably a good sign. Like we have got little bit of fever, little bit of myalgia, pain hither. Then probably this vaccine is working in you. On personal front, no problem. I got vaccine
Right,
on
sir.
16th, and that's my
Right,
take
sir.
on that.
Right. Dr. A.K. Singh, many thanks for sharing that information. That's always precious to have been heard from the people who have taken a vaccine. Dr. Nishchal, like as we know that this is one of the largest, or to say gigantic, most mass immunization program. Now, we have also had previous programs in terms of vaccination, be it polio or smallpox, but given the first group of beneficiary that happens to be not children but adult, so here the scale of studying the vaccination vis-a-vis its merits is different than what we used to do previously?
So again, here since these vaccines have been given authorization in emergency use authorization only, and the results are not available for children and the pregnant females, that's why that group has been kept out at the moment. And considering what are the other vulnerable groups which are going to benefit from this, they have been prioritized in the initial part. So again, like I said, even if we immunize 60 to 70% of our population in this drive, then of course there will be great chance of controlling this pandemic. And this is the idea behind selecting this particular group. Again, we have to remember that each one of us are vulnerable for getting this infection, but there is certain set of population who will get a severe form of disease. Everybody can get infected even after taking vaccine. That should be very clear. But the idea of this vaccine is to prevent this infection from progressing to a severe form of disease. So that's why, again, like I said, vaccine is one of the important aspects of keeping oneself safe at the moment. But at the same time, COVID appropriate behavior, what we call as social vaccination, that should not be forgotten at any cost. Because that is one thing we are sure about that will be effective even against any of the variants which we are talking about. So the social vaccination and the biological vaccination, they have to be in conjunction for at least next 1 year to end this pandemic. And again, like everybody was curious when this vaccine is going to come. So again, I will re-emphasize, vaccine is not going to end the pandemic, but it's the vaccination that is going to end the pandemic. So this vaccine hesitancy not be there. Vaccine is come. Whenever your turn comes, you have to come forward and take this vaccine. That is very important.
Right. So clearly, and that is truly a punchline. Vaccine will not be sufficient, but it's a vaccination that will save us from the pandemic. Dr. Agrawal, as we go towards the end of the show, I want to pick your thoughts about another precautions or do's and don'ts about the vaccine. Now, we've been hearing about variants. There are variants in UK, in South Africa. I know it's still relatively early days to understand the variant, given initially it was fast spreading, but there are reports that it's more infectious. If we break down the merits of these two vaccines that we're using for emergency use, Covaxin and Covishield, do we again go back to drawing board to understand the effects of vaccine on a new variant? I know cases are far lesser in India so far, and thankful for that.
So I think in each country, we will not need to go back to study the effect on variants. Already in the areas where these variants are common and there are people who are immunized, the effect of vaccines on these variants is being studied there. And we would be able to extrapolate those data to our country.
Okay.
So, that should become clear. Also, to some extent, we have to remember all the vaccines are basically using a part of the same protein, the same spike protein of COVID. So if we can see that 2 or 3 vaccines used abroad, the antibodies produced against them are effective against the variant viruses there. The vaccines we have, if they are using the same protein for developing antibodies, then even with variants, our vaccines should also work. So I don't think we have to do it for each vaccine and for each country very clearly, but we will have to wait for data to see how things turn out to be. Yes, the vaccines that we have available today compared to the vaccines that we had against other diseases are much more amenable to change in the vaccine itself so that they can be directed against the variants. This was not an option with older vaccines, but with these vaccines, that is an option, especially with those that are, because we are using DNA technology, we are using mRNA technology, even the vaccines that are based on something like a adenovirus backbone, we can change the insert there and they can be modified to look after the variants.
Right. So clearly this is what our experts are saying about vaccination precautions and do's and don't. Please listen to all the experts. That's what we keep appealing to our viewers. Well, many thanks, Dr. Rakesh Agrawal from ICMR for joining us. Many thanks, Dr. Rana A.K. Singh from RML, and many thanks, Dr. Neeraj Nishal from AIMS. Pleasure to have you on the show, gentlemen. And we sign off on this note, but before we leave, a small little advisory that is also, which is reiterated by the experts to our viewers. Well, here is it. Keep maintaining COVID-appropriate behavior, keep wearing a mask, keep washing your hands, and do not forget to maintain physical distancing. Well, that's it in this edition of IFB. Please keep watching RSTV for more. Thank you and goodbye.